ER doctors and nurses, have any of your patients surprised you with their amount or lack of pain tolerance? Story 1. Radiographer here. As a student, I met a patient who was a typical little old lady. She came in with far too many shopping bags and walked extremely slowly. She'd been sent by her GP because she had fallen getting out of the bath a few weeks previous. So we brought her in and took the first image, a P pelvis if you're wondering. And her pelvis was absolutely ruined. Turns out she had slipped and fallen with one leg in and one leg out of the bath and taken the whole fall on her vagina. Not wanting to cause a fuss, this woman had ignored the pain and carried on her life as normal for weeks, long enough for the fractures to be fairly healed, albeit in a strange way, not really resembling a pelvis much anymore. Story 2. ER doctor. 50-year-old guy with a massive heart attack just laying there chilling. Ask him his pain level. Deadpan. Just a little. 5-year-old boy with both forearm bones fractured and dislocated, playing on an iPad with the other arm. 60-year-old lady slips and falls, destroys pelvic bone. Just wants one Tylenol, and scooches out of bed, wanting to walk home. After much convincing, she begrudgingly accepted that might not be a great idea. There are some badass people out there. Story 3. Firefighter and Medicare. Farmers seem to be tough. One time a guy pulled into the front ramp, got out of his truck and walked up holding his severed forearm in his other arm. Get him in the truck, take off. Along the way, he states he lived down the road and wanted to get to us quickly. When asked why he didn't call 911, he replied, "I just cut my arm. I ain't dying." Also had a battle of the bulge vet tell me that he didn't need a blanket. It was -7 with wind chill. Story 4. ER doctor here. My intern year in residency, I saw a 17-year-old kid who, while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail, causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting, separating, the nail from the tissue below. If your stomach didn't turn reading that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked me in the eyes and said, "Doc, just take it off." Without anything? Yeah, it's fine. They fix our cuts without numbing medicine, but it's going to hurt a lot. I have to scrape. I know. So I went at it. He grabbed a towel with his other hand, and I went to work. 45 minutes later, the nail was off, he was repaired, and I replaced the nail in its rightful place. The kid didn't even make a noise. TLDR, hockey players are fucking badass. Story 5. Working as an EMT, I got called to a 64-year-old female, slipped in her house, probably sprained ankle. When we got there, the woman was sitting in a chair with her legs stretched out in front of her, but she had long pants and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all, so I figured this was going to be an easy trip. I knelt down in front of her to take a closer look, and wasn't I surprised to find that it wasn't just broken, it was fucked right up. I mean, the foot was at a 90-degree angle to the outside, and it was also leaned down, so what should have been the side of her foot was facing straight down, and the bone that should have been holding the ankle in place was pushed against the skin on the inside of her ankle so hard that it was about to rip through. I was bewildered at the fact that at the moment she said, "It doesn't hurt, so I hope it isn't broken." She hardly made a peep on the ride to the hospital. 35 miles, very bumpy. Come to find out she had multiple sclerosis, and that makes people feel pain differently. Story 6. A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but it can be quite fun as you can chat to the patient. My friend was engrossed talking to him about his experiences in the Second World War and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines or in the trenches in Flanders. After he put the last stitch in, my friend started clearing up and found the local anesthetic bottle unopened. He realized he'd not put any local in at all, and yet the guy didn't once flinch, leave aside, complain. When asked why he didn't say anything, he just said, "Oh, I thought that's how it's supposed to feel. I didn't mind. Lovely chatting to you. Then walked out. Don't make 'em how they used to. Lanacane edit, spoke to my friend last night. I totally didn't do this story justice. The laceration was sustained in a machete attack. 2 guys tried to break into the man's house and 1 slashed at him, but he fought them off long enough until the neighbor started to run over and they scampered. Such a relevant detail. How could I have forgotten? He had to clean the wound out thoroughly, which is even more painful than suturing. And to those of you pointing out the Flanders inaccuracy, that's purely my incorrect phrasing. It was World War II, so ignore the trench comment. I'll refrain from the obvious, I'm a doctor, Jim, not a historian line, or perhaps I won't. Story 7. Working in a hospital has taught me the downside of abusing painkillers and drugs. Patients constantly come in here with long-term substance abuse issues, and now that they are actually hurt, MVC, broken bones, etc., you can give them enough drugs to put down a horse and they will still feel everything. That is one of my biggest fears. I had major back surgery when I was 14, so I pretty much live with constant pain. I will do everything I can to avoid taking Vicodin so that when I get older and I really start to hurt, I haven't built up a tolerance. The only thing that sucks about it is that the pills expire before I use them all, and so when I really do need them, getting a new doctor to prescribe them is really hard. They always try to treat me like a junkie trying to score, and while it's understandable, it really pisses me off. Story 8. Not a doctor, but my goddaughter was born very prematurely, requiring a major open heart surgery at 2 weeks old. We were told by our docs that since she had gone through so much surgical trauma the first few weeks of her life as a neonate, they gave us the example that if she put her hand on a hot stove as a kid, she would have sustained a severe burn before feeling any pain whatsoever. She never cried as a kid when she got shots or fell down or banged into things, even when it was enough to draw blood. I suspect her medical history was the cause. Story 9. Not ER, but actually a cashier at a fast food place. A woman ordered 2 meals, and since she was a little older, really old actually, I offered to bring her food to the table so she wouldn't have to wait. I get there, and her husband had wads of paper towels stuck all over his arms with electrical tape, and his right hand and part of his face were a mix of blood and second-degree burns. Turned out he was working on his lawnmower, and the engine blew up on him. They stopped for lunch on the way to the hospital for burns, and the metal they couldn't get out. He was acting like it was nothing. Story 10. ER doctor here. I can't count on 2 hands the number of patients I have seen that are covered in tattoos and are scared of needles, or IVs. I mean, complete phobia. It makes absolutely no sense. If anyone can enlighten me as to how this phenomenon can exist, I'd appreciate it. Story 11. I had a patient with an open tib-fib fracture. The bones of the lower leg sticking out, and below that, it looks like jelly. Trying to walk away, apparently unaware of how bad his leg was. Of course, he was incredibly drunk at the time. Story 12. I was chatting with my physiotherapist one day about pain tolerance, and she said that she once had an ex, maybe, cocaine addict as a patient whose tolerance was absolute 0. She couldn't even touch him without him perceiving it as painful, let alone stretch or manipulate his body. She said he was a very challenging case.